Good afternoon. My name is Nurse Talisha Gordon. I'm a staff nurse and I'm working at the ophthalmic unit at the JNF hospital, and today we'll be talking about glaucoma, which is commonly known as, people refer to as pressure in the eye. Okay, and we'll be discussing what is glaucoma, the pathophysiology of glaucoma, that is how it developed, some causes, some risk factors of glaucoma, some treatment of glaucoma, and risk factors of glaucoma, and some management in terms of nursing management, medical management, and surgical management of glaucoma. Okay, so we're gonna start with the normal, because for every disease you must know how the normal eye function first before we go to the abnormal. So I have a model of the eye here, and the front of the eye, just imagine the cornea, which is the clear part of the eye, is covered. The front of the eye is filled with a clear fluid called the aqueous humor, which provides nourishment to the structures of the front of the eye. The fluid is produced constantly by the ciliary bodies, and you can't be seen because it's on the inside of the eye. So this fluid fills up the whole anterior segment, which is the front of the eye, to nourish the eye with nutrients to remove the dead cells and what have you. The aqueous humors, it then flows through the pupil from the inside, comes through the pupil, and it will exit through the channel in the corner, which is called a trabecular meshwork. Is some tiny channels, and these are located in the filtering or drainage angle of the eye, which is known as the angle. Once it is clear, that is where the fluid leaves the body into circulation, so it could be excreted. So this is the normal fluid form in the eye to nourish the anterior chamber, and then it leaves the eye. And this happens normal, and the eye maintain a normal pressure once the fluid is generated and excreted out of the eye. Now the main problem or pathology in glaucoma is caused by a raise in intraocular pressure. It is this raise of pressure compresses and damages the optic nerve. The optic nerve, when the optic nerve damaged, it fails to carry the visual information of the brain and results in glaucoma. And I will go over that again. You see the eye here is a closed organ. There is no leaks or anything in a normal eye. If the fluid that is produced in the eye cannot have a way to exit out of the eye through the meshwork, the optic nerve, which is this, is the most sensitive part of the eye, and that is the part that will get damaged from the buildup in pressure. And as we go along, we will know exactly how, and I have a little illustration to show you. Now the definition of glaucoma. So that was the normal I was explaining. And glaucoma is often called the silent thief of sight because of how it progresses and how it silently goes with one's sight. Glaucoma is a collection of diseases linked by a common outcome, which is irreversible damage to the optic nerve. Once glaucoma damages the optic nerve, it is irreversible, meaning that you have no cure. All the nerve fibers, once it's damaged, it cannot be repaired. Glaucoma is characterized by a particular pattern of progressive damage to the optic nerve, and it generally begins with a subtle loss of peripheral vision. That is why it's called a silent thief, because it doesn't go with your central vision. It starts from the side, come in, until it goes with the total vision. If left untreated, it can progress to a permanent loss of vision. Okay, so that is why you call it silent thief of sight. So this is a picture here as well, showing, this is showing the normal eye. You see the blue arrow here. This is where the fluid is generated. It flows through the pupil, which is the black circle in the eye, and it flows through the trabecular meshwork. and the eye maintain a normal pressure. Once this angle becomes blocked, the fluid increases, pressure increase in the eye because it have producing more than it is being excreted. The pressure on the optic nerve causes damage to the optic nerve, which is glaucoma. This is someone with normal vision. As glaucoma progresses silently, it starts with the peripheral vision. So you realize that someone with glaucoma, they are unable to see to the side. I'm going to have to actually turn your head. Whereas a normal person, we can see on a 180-degree angle without looking. But glaucoma go with this side, the peripheral vision to the side. So eventually, you have loss of peripheral vision. And I have a little balloon illustration here to show you how the pressure can damage to the optic nerve. Imagine this is the eye and the blue circle is the optic nerve. It is nice and round and has a good shape and color. As the pressure increases in the balloon, you will see how distorted and loses its color. You realize it becomes bigger. Just as in glaucoma, when the doctor examines the side of the eye, the optic nerve have a cupping depression in it. It is thinner and wider, loss of the blood vessels around the optic nerve, showing that the pressure in the eye is damaging the optic nerve. So it goes the normal pressure, you go back looking nice and round, a perfect circle. So this is my little illustration with glaucoma. Okay, feel free to stop me if you have any questions or any clarification as we go along. Now, the incidence of glaucoma. Glaucoma is known to be the leading cause of irreversible blindness worldwide. It affects more than 2.7 million individuals aged 40 or older in the United States. It is also the second leading cause of blindness among blacks after cataracts. The majority of individuals with glaucoma may not know that they have the disease. Reason being that initially, as I said before, glaucoma has no symptoms and the loss of vision is on the side and is hardly noticeable. So that's why it's called a silent thief of sight. Now I will go into some risk factors of glaucoma. Now, as I mentioned before, it is usually caused by a blockage in the part of the eye that allows the fluids to drain out from it. And some risk factors I have here is high pressure within the eye, and that is caused by a blockage of the trabecular meshwork that allows the fluid to drain out, and because the eye is a closed circuit, the pressure in the eye build up. Age. As one ages, you are more at risk. As I say, for individuals over 40 years, you are more at risk for developing certain eye conditions, cataract, glaucoma, because structures in the eye begins to weaken, the angle become narrow, causing the inability of the fluid to drain out of the eye. Ethnicity. As I mentioned before, it occurs more in black persons, affects black persons and Asians. And this is because it is known because of the melanin in our skin, and the pigment, some pigment may be collected in the angle, and that may cause the blockage in the angle. That's why the inability of the fluid to drain the eye. Family history. If you have a strong family history of glaucoma, more than likely you will develop glaucoma. If your mother have glaucoma, if your father has glaucoma, your sister. So we often tell the patients that if you have any family history of glaucoma, to get your eyes checked, Most of the time glaucoma doesn't come with any signs and symptoms, and the only way to find out that you have glaucoma is to get an eye examination done. Severe nearsightedness. If you're nearsighted, myopia, you have a higher chance of developing glaucoma because of how the eye is structured in the nearsightedness individual. A thin cornea will give you a high pressure reading when the doctor assesses the eye using the slit lamp. But we have another test, the pachymetry, to confirm if you have glaucoma or not. Diabetes, like any other chronic condition, diabetes, high blood pressure, these are other risk factors that one can develop glaucoma as well. In diabetes, when the blood sugar is too high in the blood, the lens in the eye absorb fluid and it begins to swell. That's why some person, when they have a high blood sugar reading, they have blurry vision. And the swelling in the lens causes the angle once again to become blocked and decrease in the drainage from the eye. So basically anything that interferes with the drainage of the aqueous fluid from the eye causes a buildup in the pressure in the eye, damages the optic nerve, it causes glaucoma in a nutshell. And some other causes, buildup of deposit in a drainage tube in the eye. A common example is called pseudo-exfoliation glaucoma. You can have new blood vessels developing in the angle where the fluid is supposed to drain in the eye that block the drainage of the fluid. Uveitis, chronic uveitis, which is the inflammation of the anterior chamber of the eye, that is the iris, the lens, and the cornea. Anything it causes swelling, redness, maybe some blood discharge. The inflammation process causes the angle to become narrowed and inhibiting the fluid from draining outside the eye, causing a buildup in the pressure, causing glaucoma. Long-term use of steroid eye drops such as prednisolone, this can cause glaucoma as well. Any eye injuries or previous surgery, if you've been in an accident where you have sustained injury to the front of the eye, where you have any swelling that inhibiting the fluid to drain, it can cause glaucoma. Some eye surgery such as cataract surgery may cause glaucoma as well. A problem with the eye develop. Some children are born with glaucoma. You have congenital glaucoma. The eye was not developed properly, so you have the eye pressure, and it's called ophthalmos is another name for it. The child eye appears blue and swollen, like bubbler, purging out, because the child eye usually is soft, so the fluid forces the eyeball to expand, showing all the structures behind of it. So that's congenital glaucoma. There are many more causes. I came across this picture with some symptoms that may want you to think glaucoma. Glaucoma don't usually come with symptoms. Some person might be normal and just say, I just feel like to get my eyes checked up, or maybe I might have a little blurry vision. But if you have any of these symptoms, most of the time the doctor will want to refer you for an eye exam. Waking up with headaches in the morning. Sometimes some children come with frequent headaches after reading, after being in school for a long time. Any adults headaches, they will want to refer you to get an eye exam to rule out any eye condition. And glaucoma. Cataracts. Cataract is the clouding of the lens in the eye, and the lens is located behind of the pupil, and that is where the angle is. So anything that blocking the fluid from draining out of the eye can cause glaucoma. Red eye, the same as the uveitis, but uveitis is much severe than the red eye. Any inflammation process, anything that causes swelling, inflammation, and damage to the angle can cause glaucoma. Some person might complain of nausea and vomiting, visual impairment, and eye pain. Visual impairment might not be at the first instant, because as I say, the silent thief of sight, it comes from the side. Some person might say when they're driving, they can't see around the corner, they have to turn their head, or when they're leaving from a door, they might be going into the doorpost because they have to turn to see the doorpost. That's a sign that you might need your eyes checked to check for any glaucoma. Some person might have eye pain with glaucoma, but there's a type of glaucoma, the closed angle, which we will get into soon, that come with pain in the eye. No? Any questions so far? We're going good? Okay, eventually risk factors are ready. Now there are many different types of glaucoma, but I'm just going to go through the 4 common types that we have. We have primary open angle glaucoma, angle closure glaucoma, and normal tension glaucoma, and I could mention some secondary glaucoma. As I say, anything that causes damage to the optic nerve with the increase in pressure is glaucoma. Now, primary open glaucoma. This type of glaucoma, the optic nerve damage resulting from increased pressure in the eye, is caused by the blockage of the trabecular meshwork. If I can go back to the front page, this is where the angle is. It is open, but there's an increase, there's a problem in the meshwork that causing the fluid to block up, that's causing the increase in the pressure. Patients with open angle glaucoma do not have eye pressure that is, sometimes it is not elevated beyond the normal, and I should mention the normal is from 8 millimeters to 22 to 20. And you may have the eye pressure be with a slow progression of loss and vision loss, very slowly with the open angle glaucoma. It's a gradual process. However, eventually the entire vision will be lost if not treated. So that is why we cannot overemphasize the idea of getting your eyes checked, because glaucoma is something you might not know you have until you get your eyes checked, and if you left too late, you need treatment as early as possible. So that's the open angle glaucoma. You have the angle closure glaucoma now. This type of glaucoma occurs due to the narrowing of the angle between the iris and the trabecular meshwork, which turn obstruct the outflow of aqueous humor from the eye. So whereas in the open angle, the angle is open, but the meshwork, the drainage is clogged. Now the angle closure now is the narrowing of the angle. The angle, the space where the fluid is supposed to flow through, that is blocked. The narrowing damages the function of the meshwork until it fails to keep up pace with the aqueous production and the pressure rises. It can be triggered by medication use to dilate the pupils. It can also occur spontaneously in a darkened room where the pupil dilates automatically. So this is where the iris blocking the angle. So the iris, which is the colored part of the eye, it may press back to the lens, causing the pathway for the fluid to drain out, to be blocked. Treatment of this is to constrict the pupil and make the pupil small, And once the pupil is small, the iris becomes bigger. So it just forcing it to make the pupil small to help it to cause it to be unblocked so the fluid could be drained out. So that's angle closure. Acute angle glaucoma closure, in some cases, it may happen rapidly, causing eye pain. In this case, when you have the eye pain, the redness, and the hardness of the eye, it is emergency situation because the pressure is so high that it causing the pain and the redness, and it can cause vomiting, headache, and seeing halos around bright lights. Emergency treatment is required in this case with laser or incisional surgery. So that's the acute angle closure, and this can happen if you have any accident where the iris and the lens become damaged, closing the angle, and the pressure build up very rapidly, causing the redness and the pain in the eye, and that need prompt surgical treatment, or as mentioned, laser surgery. There is also normal tension glaucoma, and this one is sometimes hard to or difficult to diagnose because the pressure in the eye is normal, but then you're still seeing some damage done to the optic nerve. Glaucoma occurs in the presence of a raised mean intraocular pressure during testing. There may be presence of optic nerve damage or an open angle between the iris and the cornea. It happens in elderly and females, and it is due to decreased blood flow to the optic nerve. So in this type of glaucoma, as in the definition, a group of diseases that damage to the optic nerve. So although the pressure might be normal, the optic nerve is being damaged from the decreased blood flow to the optic nerve. So it is termed as normal tension glaucoma. Now, secondary glaucomas now is caused by the result of blockage of the aqueous outflow system due to other eye diseases. So any other eye diseases that causes any damage to the meshwork, to the outflow, to the production of the aqueous humor, causes damage to the optic nerve by the increase in pressure. You have neovascular glaucoma. I mentioned this before, where new blood vessels develop in the eye and causes new blood vessels develop in the meshwork, causing a blockage in the angle, causing the increase in pressure. Traumatic glaucoma, as I mentioned before, any injury to the eye causing damage and swelling or any laceration to the eye, where red blood cells, if you have any bleeding in the eye, that can cause the increase in the pressure. Pigmentary glaucoma, there's a deposits of pigment in the trabecular meshwork, causing it to block the drainage, increasing the eye pressure in the eye. And you may ask, how can someone be tested for glaucoma? As I mentioned before, the only way we know someone, you can't watch somebody and say you have glaucoma. You have to get an eye exam done by an ophthalmologist. It says sometimes it may be difficult based on symptoms alone, but you need a evaluation by the ophthalmologist. It involves examining the optic nerve by looking through with the ophthalmoscope to the optic nerve. Sometimes you need the eye to be dilated using dilating drops to dilate the pupil, and so the doctor can have a better view of the fundus, which is the back of the eye, and the optic nerve as well. They use a tonometry This is an apparatus on the slit lamp, the microscope. Anyone who's been to the eye doctor before, right? And the slit lamp, which is the microscope that they use, they have an apparatus on it to measure the intraocular pressure in the eye. As I mentioned, it normally weighs between 8 and 22. And if it is above 22, you're not going to be diagnosed with glaucoma right there and then. We have to ask you if you have any family history of glaucoma. You have other tests. You have the visual field test, you have the pachymetry test, you have the size of the excavation, as we call it. That's how damaged the optic nerve is, to determine glaucoma. There is also another test called a pachymetry. It measures the thickness of the central part of the cornea. The cornea is the front part of the eye, the transparent membrane. And as it gives an idea of the damage caused by the raise in intraocular pressure, it can also affect measurement of the intraocular pressure. A thicker cornea may give a false high reading, whereas a thinner cornea may give falsely low pressure reading. The ophthalmologist can better understand the intraocular pressure reading and develop a treatment plan for this. So that is the pachymetry. It measures the thickness of your cornea. Because if your cornea is thin, it might give you a false positive. Because when you press on the cornea, if it's thin, now if I may use the example of the balloon, you may have a thin balloon and you put air in it. You might feel really soft with a little bit of air, but you have a thick balloon and put in the same amount of air in the balloon, you can still feel firm. So that's how the pachymetry will minus or subtract the number and give you the real pressure reading in the eye. We have the gonioscopy. It measures the angle between the eye. Some persons have different eye shapes. So this gonioscopy is a microscope, is a lens. It measures the actual angle to say if you have a narrow angle or if you have a wide angle. So it gives you an idea of your chances of developing glaucoma or how severe it is. You have the visual field test. It is commonly used to assess your peripheral vision. It is a visual field test that produces a map of your complete visual field. During this test, you'll be asked to look straight ahead in a bowl-shaped machine and then indicate by clicking a button when a moving light passes your peripheral vision. So how we do it? It's a bowl-shaped machine. I don't have a picture of it, but many of you may heard of it before. You have to sit and look straight at a light. The machine will then flicker some light around in a bowl shape, and you have to press the button whenever you see the light. So that is to assess your peripheral vision and give you an idea if you're in the normal limits or outside the normal limit. As I mentioned before, we should be able to see on a 180-degree angle. And if you realize that the machine is flicking the light over here, like you miss that light, you may say you have some decreased vision on that side. And based on the degree, the machine will map it out. Once ago, before that machine was developed, they had the confrontational, where the doctor directly in front of you and asks you to look at the finger. And as you go to the side, you have to keep looking at the doctor and tell us when you stop seeing the finger. Some person may stop seeing it as close as here, some person may see it far here. So it gives you an idea of how far, or if you had lost any vision to the side. Because remember, glaucoma is go with the vision from the peripheral, from the side, not central. So that was the visual field test, the confrontational test. And all of this come together along with any risk factors you may have, family history you may have of glaucoma, and the size of the optic nerve. If there's any damages, they map it by points. So you might hear excavation 0.5, 0.4, up to 9 is the highest, meaning that how much of the disc is damaged. The doctor will determine glaucoma. Any questions before we move on?
So lately, sleeping a little. Lately you wake up and I notice an alarm. Sometimes headache.
In the mornings?
You know what? Lately, when I have the front and headache, so it's a sign that my eyes are blurry sometimes.
Well, it is a sign that you may need your eye checked, because headaches is linked to vision defects, visual defects, so you might have some problems. You might need to get your eyes checked. It might not mean you have glaucoma, it might just mean maybe you need some help with glasses. So the treatment of glaucoma, we have medical treatment and surgical treatment, and we often use the medical treatment more than the surgical treatment. Surgical treatment in severe cases or emergency. I will start with the nursing management. The goal of nursing management is to prevent further visual deterioration, promote adaptation to changes in reduced visual acuity, to prevent complication, provide information about disease to the patient, the process, the prognosis, and the treatment needs. The treatment can't reverse any loss of vision that has already occurred. So this is important. Sometimes the doctor does tell the patient, emphasize the patient, because sometimes the patient come and they're looking for a cure. But with glaucoma, if you already lost 5% of the vision, we can't get back the 5%. What we can do is prevent it from getting worse. So, but you can help but it can help stop your vision from getting any worse. We also tell the patient to follow up every 6 months to determine if the treatment is working or if any worsening in the condition, if you have any complications. We have to implement measures to assist patients to manage visual limitations, such as reducing clutter, arranging furniture out of travel path, turning head to view subjects, correcting for dim lights and problems of night vision. So this is something we can help the patient with at home. If they have any loss of vision, they get a family member to help them to move furniture out of the way because they have a problem with seeing to the side. Help them to move the clutter so they can help them to live an easier life with a vision problem, so they can find any item easier. We have to demonstrate administration of eye drops and adhering to schedule, not missing doses. And this is another thing. Once you have glaucoma, you have to use the eye drops for the rest of your life, basically. Just like high blood pressure and diabetes, you're on the eye drops for the rest of your life. I know this is something could be a drastic change in lifestyle, but we have to tell them, don't forget to miss a dose. If you miss one, try to not to put in double dose, but to just get the next schedule. Most of the eye drops is once a day or twice a day. So if you miss in the morning, try not to miss in the night, because the treatment is to help the vision from getting any worse. And we have to stress the importance of meticulous compliance with the prescribed drug therapy. We also tell the patient, if you have any problem with the eye drop, some eye drop may cause an irritation, any allergic reaction to the eye drops, always come or call to report it, so another eye drop can be prescribed that won't have an allergic reaction. As I mentioned before, follow-up is important. The patients are followed up 6 months, 8 months once they are stable, but every 6 months, and this is to assess if the eye drops are working, if they need to change. Sometimes they need to be on 3 different eye drops, and once the eye pressure is maintained and there is no further damage to the optic nerve, then they can go down to 1 eye drop. But we need to stress the importance of follow-up. Is important to make sure that the treatment is working. Avoid heavy lifting and pushing, shoveling, and wearing tight clothes or constricting clothing. You realize when you lift something heavy, you feel the strain in your eye. It's saying how a person with glaucoma, they want to avoid heavy lifting and straining to avoid increasing the pressure in the eye. Eating food rich in fiber and adequate fluid to prevent constipation. Again, that's to prevent any straining during defecation. Use of hygienic technique when handling the eye drops. Not to let the bottle touch on the eye when you're opening it, and just let the water drop in the eye. Don't let it touch on the eye to prevent any bacterial contamination, to prevent any infection to the eye, because you don't want anything to complicate the glaucoma. We advise the patient to report any severe eye pain, inflammation, photophobia, visual effect, veil-like curtain over the eye, blurred vision, and these are all complications of further vision loss that may need to be detected earlier, so we can implement earlier management in the eye. So these are some of the common eye drops that is used locally and elsewhere. Listeners, if they have wearing special glasses, the anti-glare glasses, to help to decrease the photophobia sensation when you're out in the sunlight. The carbonic anhydrase inhibitor. This is one called Chusop, the brand name for it. And this is help to reduce the production of the fluid. So one of the treatment, what it does is to reduce the fluid in the eye. Because once less fluid is being produced, the lesser the chances of it building up to cause damage to the optic nerve. We also have prostaglandin like Xalatan. This one, well, I'm calling the common name, even though you see the generic name, you might hear of Xalatan and Chusop. This is Xalatan, and it reduces the intraocular pressure as well. Pilocarpine, this is the one to constrict the pupil, is a miotic, and in emergency cases, as I mentioned before, with the angle closure, where the iris is closing to the lens, you use this one to constrict the eye. We don't use this one as a regular daily eye drop, because it will cause you to not be able to see properly eventually. And this one is Alphagan. It helps to reduce the production of eye fluid and improve its outflow. So whether the medication reduce the fluid and improve the outflow of the eye as well. The beta blockers such as timolol, it helps to reduce the production of the flow of the aqueous fluid as well. This is the timolol. Most everybody familiar with it. It's a beta blocker, but doctor always asks if you have any asthma, if you have any heart problem, before we prescribe timolol, because it can also affect the asthma and the heart. Combigan is a combination. You have in timolol and COSAP. So some of them need to be stronger. So the company have two different types. The Combigan is also a beta blocker combination. So these are some of the common eye drops we use in glaucoma. Sometimes you might only need one to use twice a day. This one is mostly using just in the night time, or sometimes you just need a combination one. Some person have severe glaucoma that they may need 3 of them, alphagan, timolol, and xylatan, or the COSAP, timolol, and alphagan, until the pressure is under control and they can be titrated down to one eye drop. So as I mentioned before, these eye drops, you have to use them every day for the rest of your life, just as if you have diabetes, we have to take metformin and insulin. So there's glaucoma. Surgical management is not common, but we do have some patients that need surgical management of the glaucoma. And the surgical management, what we do here in St. Kitts is a trabeculectomy, and this is creating a hole or opening in the sclera in the white part of the eye. If I may go back to my model, is creating a hole in the sclera so that to help the fluid drain out from the eye. So every mode of treatment is to get the fluid out of the eye. So as I mentioned, the eye is a closed circuit, so if you create a hole to help the fluid drain out of the eye, it will help to maintain the eye pressure somewhat. So this is the flap they created, and the surgery is successful when you see a bleb on the white of the eye. That is where the fluid collect, and then the blood vessels, they will collect the fluid and to excrete it out of the body. It is located under the upper eyelid. There's also laser surgery, which we don't have here in St. Kitts, but there's laser surgery where you create holes in the iris, in the colored part of the eye. Holes is created in the iris, and this is to help to, again, to allow the fluid to drain from the eye. Okay, any questions so far? Near in the end, I have one more slide. Okay, so patient and family teaching. Eye drops are normally used between 1 and 4 times a day. It's important to use them as directed, even if you haven't noticed any problems with the vision. Some persons might come when I start using the eye drop, and I say, I don't have any more blurry vision. I feel fine, my eye don't feel heavy or anything, but you have to that means the eye drops are working. So if you stop using the eye drop, that means you're going back to square one. You're going to start having the blurry vision again. You can't see again. So it's good that you continue using the eye drop. So you have to help them. I know it might be stressful sometimes having to remember to put in eye drops in the eye, but it's for your good. You don't want to be blind and knowing that you can't get back your eye. You can't get a false eye that is working, so you have to work with what you have and try to, maintain the eye drop schedule. And use as directed. If you say twice a day, we prefer 8 in the morning and 8 in the night. Split the day in half. Not 8 o'clock and 9 o'clock, and then say you use it twice a day. That's overdosing. if you put it in so soon. You split the day in half. If it's 3 times a day, split it in 3. And it's according to your time. If you prefer 6 o'clock in the morning, 8 o'clock in the morning, 9 o'clock, based on your schedule, you can put in the eye drops and make it more comfortable for you. And the hygienic practices, you wash your hands with soap and water before. You have to use one finger to pull down on the eyelid, and you squeeze the bottle, let the drop fall in. Don't let the tip of the bottle touch on the eye. If someone is doing it for you, some elderly person might have someone home putting in the eye drops for you, you let the family member, relative wash their hands before they put it in the eye drop, and it's to prevent bacterial contamination that may cause conjunctivitis, which may cause redness and inflammation in the eye, which we don't want to complicate the problem. Keep the eye drop in a cool area of the house, away from sunlight, away from increased temperature, heat. Some person will prefer to have them in the fridge, which is fine, or you can have them in the table, in the bedroom, and the nightstand, in a cool area, clean area away from sunlight and heat. Allow at least 5 minutes between using different types of drops. Some person have to use 2 different types of eye drops. So if you put in one, you wait about 5 minutes before you put in the other one, and this is to help the first one to be circulated around so the body can accept it, and to prevent any drug interaction that may occur. And the eye drops are used for the rest of your life. You have to, not when some persons stop using the eye drops when the bottle is finished, but it's something they have to keep getting to use over and over. Encourage the person to make necessary changes in lifestyle. As I mentioned, the heavy lifting, eating a high fiber diet, water in the diet to prevent constipation, so the stool can be soft. Avoid heavy lifting, and the doctor also say caffeine drinks. Avoid caffeine drinks and bubbly drinks like the sodas and the carbonated beverages that also play a role in increasing the eye pressure. A tranquil lifestyle will reduce the overall stress of your life, preventing ocular changes that push the iris forward. So living a stress-free life, and stress is the precipitator of all medical conditions. If you look in any medical conditions, stress is always there that causes the condition to be worse. And encourage family members to get eyes checked for glaucoma. Sometimes you don't know you have it, but if you have known anybody in your family, you have to encourage them to get the eyes checked by the ophthalmologist. And that's it for the end of my presentation. And just to recap, remember, glaucoma is the silent thief of sight. It have a slow progressive loss of vision, which start from the peripheral vision coming to your central vision. And most of the time it does not have any symptoms. You may have it and not know that you have it. The only way to know for sure is to get your eyes checked by your ophthalmologist. The treatment cannot reverse the vision that was lost already, but it can prevent it from getting any worse in the vision. Prevent your vision from getting worse. The pachymetry is a test, is a handheld instrument to go on the cornea. Yeah, they touch the clear part of the cornea. It measures the thickness of the cornea, if it's too thin or if it's too thick. And it will give you a number. Like for example, if the slit lamp give you an intraocular pressure of 10, the pachymetry might say -2. So your real pressure might be 8 instead of 10. Yeah, determine if it's thickness or the thickness of the cornea.
And you said with age, 40 and over, you're more at risk.
You're more at risk as you get older.
So, without, I forget the exact word I use, like trauma to the eye, like if you got an accident or something, I forget what you say told me, but so you have people that have glaucoma under 40?
Yes, we have children with glaucoma, and these children with glaucoma maybe because of strong family history. So they're born with glaucoma signs, and they develop glaucoma earlier than 40. Yeah, we have children on our registry with glaucoma.
So if one have glaucoma, I mean they eventually gonna be blind?
You can prevent the blindness by early treatment, by early detection and early treatment, and maintaining the intraocular pressure. Once the pressure is maintained within the normal limits, you can prevent damage to the optic nerve. So it's a preventable blindness condition.
Glaucoma
doesn't mean that you will go blind.
As long as you
Once you do the treatment, take the medication on time, you can prevent it for a long time.
The fluid could not build up? Is there any way to prevent the building up of the fluid in the first place? No?
The medication used to help to reduce the amount of fluid being built up. But you need the fluid, because I mentioned the aqueous fluid is to nourish the anterior segment of the eye. Yeah.
So what is could you give us an idea of we might not know ratio, but on a whole, the federation, are you seeing more and more people with glaucoma?
Yes, we have a lot. We have a lot of patients with glaucoma at the eye clinic. Maybe in a week, a rough example, I estimate we might have 6 cases of glaucomas, and most of these patients, they just come for a regular eye exam, and they're not knowing that they had glaucoma. What the doctor does is do a comprehensive eye exam. If you come with red eye, the only time they wouldn't check your pressure if you have any infection in the eye. But if you just come for a regular eye exam, they check the eye pressure, they look at the fundus, look at the optic nerve, and this is how most of these cases are detected. I have some stats here. We have 1,236 registered patients in glaucoma. 540 males and 696 females. And it's more, because this was last year. This is last year information. So for this year, it will be more. We also always have an increase in glaucoma, especially in St. Kitts.
Actually checking.
Yes.
So we still have an unknown number.
We still have an unknown number of the real person.
Can you say anything to the general public I'm so happy because it's a timely glaucoma, talking about it is timely. Why? Because January is, I think, glaucoma
awareness.
Right. And we're waiting till January. We are here now in December trying to, bring it to light, and we want to have you say something to the general public about going about having it checked, whether it's at the hospital or privately, because as we see, it's important, and you tied in many things. I was listening. You tied in many diseases with glaucoma. So can you say anything to help the general public? You're here, that's help, but can you say anything for us, please, to bring light to this, to get them to come in to get tested? Because that's the only way, and it's silent for some.
Yes, the most important thing is to remember that glaucoma is a silent thief of sight. So just in this phrase here, it is silent, meaning that you have no symptoms, hardly have any symptoms. thief is sneak up on you, you don't know when a thief is coming into your building. Is a thief because it's coming in from the side. It's not coming in the front. It's coming in from the side. So it's sneaking up on you. It's walking soft. And the only way to get it checked or to know about it is to get your eyes examined by an ophthalmologist. Not an optician, which is glasses, but a medical ophthalmologist to check inside of your eye, to check the optic nerve, to assess if you have any glaucoma. If you have any family members that have glaucoma, you might see a family member, yeah, it's putting in eye drop. Ask them, you may ask them what the eye drops for, because it might be because they have glaucoma. That's why they're using these eye drops, and you might not know that the family have glaucoma, so that will give you an idea that you may need to get your eyes checked. So check, always. Don't be afraid to have an eye examination done. It is pain-free. To get the eyes checked, you have to, the doctor always putting anesthetic drops in the eye so you can be comfortable during the eye exam. So it's important to get your eyes checked by your ophthalmologist. Any other questions? Go ahead, Siobhan.
You said, especially eye drop there, I don't remember the name, the one with the yellow cover.
Timolol.
You said that one could affect you if you have asthma and so forth, so then therefore important when you go check your eyes to tell the doctor if you have underlying conditions and what's not, so they could know exactly what to give, because to prevent it from triggering or something else.
Yes. The nurse asks in our history taking, diabetes, high blood pressure, any heart problem, kidney problem, asthma. We always ask. The doctor as well, he or she have a role to ask to. Because a beta blocker, it can increase the heart rate, or constrict it can constrict the airway in the lungs, causing it difficult to breathe as well. And if you're allergic to sulfur as well, you have some eye drops contain sulfur. If you're allergic to sulfur, you have to say, if you have any kidney disease, you have to say, patient is encouraged to say which, and the doctor will ask as well.
And for the surgical one there, when you say if you see a course,
the bleb.
You say, yeah, so if the course ain't come, I mean,
well, I mean, the fluid is not collecting in it, so the doctor will have to check to see if the opening that was made, if it's patent, meaning that if it's open, or if they have to do some adjustments to it. But it's just a way to show that the fluid is collecting, so the fluid is coming out.
So is there like a time limit that you all watch to see?
Well, during the follow-up exam, because after the surgery you'll be following up the next day, maybe 5 days, doing the follow-ups.
And when glass is new to you, and you feel like you pull in your eye and so, that's normal, right?
Sometimes it's normal, but you still have to ensure it is not too strong. But you have some adjustment with the depth perception, especially when you're stepping down or when you're walking with your glasses, until your eye and your brain get accustomed to the new.
So what about when you take them off now, you feel like you can't do without it, like your eye blurry and that, not normal?
Yeah, it's normal. It's normal. I asked one ophthalmologist to come to a hospital to do a lecture, and she says it's a myth that that your eyes get worse with glasses. Her explanation was that because our brain is usually with the glasses, the brain is accustomed to seeing clear. So when we remove the glasses, it's trying to readjust to the blurry vision that you have. So you may feel as if that you need the glasses to see.
Oh, okay. Because I know somebody has some new ones, and when the person take them off, the person say like it's blurry
Yeah, because your brain
You
have to
can't
get
without them.
your brain have to get adjusted back to the normal blurry vision.
Now what about glasses care? Care for your glasses, cleaning.
The cleaning,
Is
You have
that
to
the cloth that
use-
they come with?
it's best to use a soft cloth, nothing with the cotton lint on it to prevent scratches on the lens. And they also have the liquid to clean it with to prevent any streaks.
So
But if you don't have the liquid, you can use the soft cloth.
So it then come with a liquid.
You can use the soft cloth and some water.
Okay.
Some water. I don't have the liquid after the card.
So if you
Explain the short-sighted and the long-sighted.
Hmm?
Could you explain the short-sighted and the long?
I could do it, but you have to think. You could finish it. So thank you for listening and thank you for being a part of my glaucoma topic. Thank you.
Let's go. Good afternoon. On behalf of KNS Agency, we would like to thank you for taking time out of your busy schedule and coming here this afternoon to enlighten us on the topic glaucoma. As we know, glaucoma is one of the leading causes of blindness, and we would like our colleagues and the world to know that we have to have our eye check every 6 months to 1 year. Once again, on behalf of KNS Agency, we would like to say thank you and hope to meet you in the not near distant future.
Thank you.
Thank you.